Welcome to the Odds Fitness podcast. I'm Asad Hussain, the founder of Odds Fitness. We at Odds Fitness help individuals maximize their health span and also achieve their true fitness potential. With my formal education in exercise and sports sciences and also in lifestyle and wellness coaching, we bring to you the most data-driven insights from industry experts who specialize in the Asian and the Middle Eastern populations. These experts have significant experience considering our distinctly different variable factors such as genetics, phenotypes, cultural and environmental influences and habits. These factors contribute to the most common and consistent risk factors for lifestyle-related diseases and health and fitness challenges in South Asia and the Middle East. While there is a wealth of data and content available from the West, much of it becomes irrelevant when applied to our context, as the dynamics here are vastly different. So let us begin.
Today we have Dr. Arjun Dang from Dr. Dang Labs. He's the CEO of Dr. Dang Labs in Delhi. Am I correct? Are we present in other cities as well? Our audience would love to know.
So we are primarily Delhi focused, but we do have pan-India facilities for our patients who are not in Delhi and want to still give blood samples to us. We have teams available throughout the country, and we do very frequently facilitate their sample collection as well. We also work pan-India in multiple projects now. So vast majority, or I would say a significant percentage of our work is pan-India as well. And thank you for the kind introduction.
No, absolutely. We at Odds Fitness have collaborated with Dr. Dang Labs because we identified many labs out there, and Dr. Arjun Dang was kind enough to participate in this collaboration, and luckily we found probably the one of the best labs in Delhi and maybe in India overall, because as we compare other labs and the services provided by them, when somebody is going through blood markers, etc., you see doctors who are in that process and not technicians, and even the disposables or equipment that are being used from the flebo and the whole experience altogether is significantly at a higher standard. Am I correct, doctor?
So, Sad, again, very kind. And I would agree with you that today, when we look at diagnostics, it is hugely commoditized. And I think because of that image of lucrativeness that the pandemic gave to COVID testing, I think there were a lot of people also who jumped on to the bandwagon. But currently, what we promise is the best in services and the best in quality. I know this line would have been said multiple times by multiple labs, but we completed 41 years of existence last year. And the kind of patients that we service, the satisfaction of the doctors when they see our reports, and our relentless pursuit of having a better patient impact. I think that is what is a testimony to our uncompromising standards. And with God's blessings, we'll just go from power to power.
Well, I can second that because I've seen Dr. Arjun Dang in action. I have stepped into the lab and I've seen him caring for every single patient as though, he's somehow, related to them, even, especially when it comes to children. I think they have one of the best experiences when they visit Dr. Dang Labs. Thank you for being here. Dr. Dang, today we wanted to have a conversation so that our audience is, enlightened upon certain important things when it comes to, let's say, longevity and viewing life in a way where, instead of stumbling upon some disease, and we have so many lifestyle diseases for that matter, cardiovascular, cancer, diabetes, neurodegenerative, we at Odds Fitness want to identify a great strategy so that through our exercise, training, and nutrition, we are able to navigate what is it that we can fix in an individual and prevent any mishap and extend their lifespan or health span to the greatest degree. I will start with my first question. How important do you think it is to do investigative blood work done in order to understand what are your risk factors, and how can we integrate that with, let's say, family genetics and come down to a conclusion that, okay, this is what this person might suffer from. Maybe you could stress on the importance of that.
Great. So, Asad, again, a very interesting question. I will try to keep my answer very brief and also easily understandable by our viewers today. But if you go back about couple of decades, probably when we were in school and we were taught in our science books that you should have a plate, and in that plate you should have some carbs and some fats and some proteins, etc. You should go for a brisk walk every morning when the sun rises, and we were taught things like early bird catches the worm, and also we were taught how 2 glasses of milk and 1 apple a day keeps the doctor away. I mean, science has evolved. And fortunately, our acceptance and understanding of that science so that we can implement it more effectively has also, I think, raced ahead. Now, whatever one does has to be personalized to their lifestyle, to their medical history, to their family history, and more importantly, their health goals as well. I mean, if there is someone who's actually has multiple of his either his parents or grandparents who had certain diseases, to know his risk of developing those and then working around that to circumvent that risk, I think is crucial. Now, I will just take a simple example to explain this. And when you talk about anybody who's getting any kind of investigations done, and I also feel that investigation should be very targeted in that manner. And once your team actually is training a particular individual, they'll get to understand a lot about that person themselves. Now, if you have someone with a family history of, say, cardiac disorders, the one test I would like to do for all of those individuals is a high sensitivity CRP.
Yeah.
Now, the CRP, I think everyone relates it to COVID and says, oh, even I got a CRP done. Why are you checking me for a blood test that's for COVID? But essentially, a CRP test stands for C reactive protein. This is an acute phase reactant. In simpler words, it is a marker that increases when there's any kind of inflammation in your body.
Right.
So if you sprain your ankle, your CRP will get elevated. If you lift something heavy, maybe not in the proper posture, and you have a backache, your CRP will get elevated. Suppose you have a strep throat and you have a cough and a cold, your CRP will get elevated. There's a lady with arthritis, her CRP will get elevated. If someone has dengue, COVID, malaria, even cancer for that matter of fact, your CRP will be elevated. So, how does the CRP really help you? CRP helps you in two ways. One is to get a baseline of where you are, and then how your exercise, how your diet, how your physical rehabilitation is improving that C reactive protein. So, testing at the baseline and then testing at periodic intervals actually empowers you with that information that what you are doing on a daily basis, is it correct or not? So that either you continue doing it or you add certain things or you change it up. Now, CRP has been upgraded. Now, it's been, I think, more than a decade or even longer that what we offer is a more advanced version of CRP. This is called an HSCRP. It's called a high sensitivity CRP. High sensitivity means it's more sensitive. But for the viewers today to understand, an HSCRP, and this is how I train my team, that H for HSCRP, H for heart. So, apart from telling about the overall inflammation in your body, HSCRP also stratifies your cardiac risk. So, that means that your value is going to be divided into 3 categories, and you will be stratified basis your HSCRP value as mild, moderate, or severe. Now, for all 3 categories, there is literature that tells you what kind of diet, what kind of exercise, what kind of monitoring, when you need to go see a cardiologist, what other scans or investigations you require varies for all these 3 strata of individuals.
Right.
Now, the most important thing in this, Asad, for us to monitor is that if someone, say, has a sprained ankle and they do an HSCRP, it's going to come through the roof. So you have to rule out all other causes of inflammation first. It has to be a person who's in a pink of his health, or at least feels like they're in the pink of their health, and then do a baseline HSCRP. So once you do that baseline, it'll stratify you into one of the cardiac risk zones. And then obviously you and your team, you are experts at guiding them about the diet and the exercise and the lifestyle tips that will help them control that baseline inflammation. So I think HSCRP, and it's a very cheap test as well. It's only a few hundred rupees. Report comes in a few hours. And I think it gives you a wealth of information regarding your cardiac health and overall inflammation in the body as well.
So, doctor, now that we have spoken about the importance of testing, right? And I think it is something that can easily prevent so many diseases out there, right? Knowing something as simple as where you stand in terms of your glucose tolerance,
Yes.
or something as simple as knowing your risk towards cardiovascular disease very easily helps not only us but also the client slash patient navigate what they should be doing and what should they be even looking out for. And as I can understand, cardiovascular disease, it's very early onset. It takes decades for it to manifest. And, things like high blood pressure and, glucose intolerance, that's something, they're just silent and you don't really get to know when they cause a cascade of problems in your body. So let me try and address this one by one. Let's talk about cardiovascular disease. What testing do you think is mandatory that everyone should get done baseline for checking their cardiovascular health, considering they're 30, 35, or 40, and then let's say when they're older as well?
Again, very relevant. So, I was reading this statistic that said that 30% of Indians have hypertension, that is elevated blood pressure.
Wow.
And the surprising part about it was that 50% are unaware about it. Because I will tell you, the most common symptom of these preclinical hypertension is no symptom at all.
No symptoms.
So you'll really never find out unless you actually sit down and measure your BP twice a day and see your systolic and diastolic is more than 120 and 180. So I mean, that is why monitoring your vitals and monitoring your health is important. Because at the asymptomatic age, if you identify something and then make the correct lifestyle choices, that goes a long way. Now, when we talk about cardiac health, the one test that is done abundantly and widely, and I'm happy to see that also, is a lipid profile test.
Right.
Now, in the lipid profile test, I mean, 8 out of 10 labs are going to tell you that do it fasting. And that fasting means 10 to 12-hour fasting with only plain water that is permitted. But one thing that they actually miss out to tell you is that the last night's meal is crucial
Which you
for the
told,
next day's morning.
which you told me,
Exactly.
and I could see the difference in that.
Exactly.
Yeah, of course.
People have this weird thought process that says, ki, no, let us eat something heavy and also splurge the previous night so that before the exam, I shouldn't just be completely not eating anything fatty, but it's just the opposite.
Right.
A lipemic sample is a one where we macroscopically, once we spin the sample before putting it in the machine, we see that there's a thick layer of fat on top of the serum. So lipemic sample is known to give extremely elevated values that might not be your true value. Now, the instructions that we train our team with is that the previous night's meal should be a vegetarian, home cooked, light meal without desserts and without alcohol or wine. Now, that doesn't mean that you make paneer butter masala at home
At home.
and you eat that.
Like
It has to be a simple meal,
Right.
like what you would eat on a normal day, like some rice, some dal, some veggies, or anything of a similar style, that some soup, some salad, some bread, all that is fine, but nothing fried, nothing cheesy. You cannot have a chocolate mousse after that. You cannot have a drink or two. Please avoid that on that particular day.
Yeah.
Because what we see is that an elevated triglyceride level that happens because of these dietary indiscretions the previous night can make your cardiologist actually start you on certain treatments that are not appropriate for you because you didn't do the test the correct way. So I think the lab has to take the responsibility of conveying this information to the patient so that we can give you correct reports, empowering the physician to give you the right treatment.
Right.
And I think this is something very basic about the lipid profile that everyone should know.
So when you say the lipid profile, I understand HDL-C, I understand LDL-C. A lot of people don't know about other lipoproteins like the VLDL or intermediary density lipoproteins, are they relevant?
So essentially, I think everybody knows about cholesterol, triglyceride, HDL, and LDL.
Yeah.
But I think there are three more parameters that we offer in our extended lipid profile that helps you understand a lot more about your metabolism, about your dyslipidemia, and what to do about it. Now, the first one in the list is lipoprotein A. Lipoprotein A is again a very simple test, and it tells you about your genetic predisposition of developing any kind of dyslipidemia.
Yeah.
Dyslipidemia basically means that you have an elevated cholesterol or an elevated LDL or an elevated triglycerides.
Right.
And people with a genetic history might be paternal, might be maternal, but it basically tells you that yes, you are bound to develop dyslipidemia. So, more so the reason that you should focus on diet and exercise and try and optimize your health so that you don't have to face the consequences later. The next one in the list is apolipoprotein A and B. In this, the apolipoprotein B's value is extremely crucial. Also, is the ratio of B and A. Now, these ratios again will stratify you into certain risks along with your other parameters of your lipid profile and this and your lipoprotein A. Your doctor will advise you accordingly.
I had a question about ApoB and A. Um, from what I understand, LDL particles are encapsulated in the ApoB, and HDL are probably more directly linked with ApoA. So, if somebody has elevated ApoA, does that still put them at a risk of cardiovascular disease?
So there are certain algorithms that say that your ratio is
Mm.
what matters. It's
Right.
not the absolute value.
Mm.
So it's the ApoB versus ApoA that we talk about. Another very important thing, people who want to investigate deeper into their dyslipidemia or their cardiac health is two things. And that is what the Western world has probably by leaps and bounds ahead of us, is that they measure oxidized LDL.
Right.
Now, LDL essentially, I know we were taught about LDL as the bad cholesterol,
Right.
but again, cholesterol is present in our body. It's made by God. God could never do anything wrong. It's only when this LDL gets oxidized is when it is actually known to form those plaques in your arteries.
Right.
The second one is the particle size. The first one was oxidized LDL. The second one is particle size. Now, we are all measuring the quantity of LDL and HDL. We are not measuring the quality of LDL and HDL.
Right.
So, essentially, any small, dense particles of LDL are known to be more harmful.
Because they enter the
Exactly, and they form the same plaques.
Mm.
So again, measuring the density and the size of these LDL and HDL particles is extremely crucial. This is also a blood test. Even the oxidized LDL is a blood test. We today offer both of these, and it's again a simple blood test, so it can be arranged at request. But this is again something that I would say in the next few years would be widely available in India.
Right.
So it is important to understand and also understand the consequences of such a test.
Right, right. Oh, that's amazing. And of course, we missed out on triglycerides, right? So I think a lot of Indians have elevated triglyceride levels, along with glucose intolerance and the inability to sort of metabolize or dispose of glucose correctly. I've studied many things which link to the direct correlation of it. Uh, do you think it is because I've observed in our clients, when you go low on carbohydrates, you can significantly reduce triglyceride values because, as I understand, it's a glycerol molecule with fatty acids attached to it. Is that accurate?
Okay, so Asad, whoever told you they had elevated triglycerides, tell them to have a simple meal the previous night and retest.
Ah,
So that is extremely important because the one parameter that actually goes up significantly because of a fatty meal or a drink or some dessert the previous night is your triglycerides.
right, right.
The second thing again is triglycerides, as you said, I completely agree, is very important for us to contain. And also, you'll see a lot of doctors also prescribe these statins and related lipid lowering drugs whenever someone's triglycerides are elevated.
Correct.
So, I mean, as a baseline to understand the value, and then again, work around the entire diet of the patient altogether, even looking at their diabetic status, looking at their HbA1c, at their blood sugar control. I mean, all of it actually fits like a hand in glove to make the person's cardiac health better.
Right.
So I think that is very important. So I'm sure while you're training people, you come across people who have the metabolic syndrome or have one of these metabolic diseases or have a very strong family history. And even prevalence of non-alcoholic fatty liver disease is on the rise. And is there anything specific that you and your team do to intervene at the right time?
Yeah, of course. So when it comes to just what you described right now, you know, dyslipidemia, what we try and do is when we look at these values, a lot of these values we can fix through lifestyle interventions. We can't fix lipoprotein A, right? I've been told that there is a PCSK9 inhibitor that reduces by 30%. So that's a medical thing, and we keep away from that. We recommend experts for that. But when it comes to, let's say, your LDL-C, when it comes to ApoB, I think having the right sort of healthy fats in your diet, monounsaturated, right? Olive oil, fish, nuts, healthy sources of fats. And then, of course, if you have exercise integrated with it, I think it significantly improves their lipid profile. The other thing that we have seen is because interestingly, you spoke about oxidized LDL-C. I think we place a huge stress on how you're sleeping and what your overall, let's say, oxidative stress levels are like. You know, so exercising, having a nice lifestyle automatically reduces oxidative stress and the levels of ROS in your body, which is reactive oxygen species. So that's how we handle this. But then when I'll ask you about the next thing, which is metabolic disease, etc., maybe I'll be able to explain further better how we address those problems. So my next question from you would be, what are the key markers when we are testing for somebody's metabolism being healthy? And by that, I also extend it to, let's say, low HDL, elevated triglycerides, diabetes, PCOS, and all of these encapsulated. What markers do we essentially look at?
Okay, so again, tough question, but I'll make it an easy answer.
Please.
So you never really test anybody for a kind of a wide paradigm of what diseases they might have. I think it is more targeted in cases where you see certain symptoms, and that's why your physician's role or your doctor's role is indispensable in this process. And whenever you get any tests done, it has to be on the basis of what your health goal is, what your previous medical history is, what your family history is, what your previous blood tests show you, and is there any medical issue that you are having currently.
Right.
Now, there's something that is called as a CMP, a comprehensive metabolic panel. And especially in the West and in the UK, they use this terminology very frequently, where they include your basic things like your blood counts, your lipids, your kidney function test, your liver function test, and your lipid profile, like we just discussed, and your HbA1c blood sugars. Just the basic to get like a baseline.
Right.
I mean, this kind of a test is obviously important for anyone with the age of more than 40, at least annually. And then once in these tests and overall with your history, if you actually find out something that places you in a higher risk, then those tests should be done at least 6 monthly.
Right.
Especially if you have any intervention that you're doing and you want to figure out how effective it is. Now, apart from these tests, also it's very important that we have targeted interventions, like you said, for a diabetic patient.
Right.
Someone, okay, so let me also buzz this myth about pre-diabetes.
Right.
There is nothing called pre-diabetes. So again, either you're diabetic or you're not. Just because you're close to that range of HbA1c that shows that you're diabetic doesn't mean that you're pre-diabetic. It means you might have a higher chance of developing diabetes if you continue with the poor lifestyle. And that's why you and your team are doing a phenomenal job. And again, along with diabetes, it's not just your blood sugar, it's not just your HbA1c. It's also very important now to monitor your HOMA-IR.
Yeah.
Your HOMA-IR is basically a test that is done for insulin resistance. And in this particular test, we measure your fasting insulin as well and tell your level of insulin resistance. That is your body, if it has any kind of resistance to responding to insulin. And is it being able to use the insulin the correct way to reduce your blood sugar levels?
Right.
So, again, this is something that's extremely important. Every diabetic should get this done. Anyone who's entering into one of your interventions where they have a solid family history as well can get this done and understand their rate.
That would be most people, I think, because it also tells you about pancreatic beta cell health.
Yes, yes. So that is again, pancreas is at the center of everything because it is the one that is regulating that entire blood sugar control with the
Yeah.
production of the insulin. So again, that is important. Like you also mentioned PCOS. Now, if there's a girl who has symptoms or signs of developing PCOS, this is hair related, skin related, weight gain, and other things, then obviously it is a more targeted approach where for this girl, I might not want to test her kidney and livers. I mean, not at that priority where I'll want to test her other hormones and figure out that what is the imbalance in those hormones and exactly what she needs. More than a blood test, she might also require some kind of imaging where we can see are there actually cysts on her ovary or not. Again, so I think it is not one size fits all approach that will work with testing. It is more about targeted testing, it's more about precision medicine. And for the same reason, I was chatting with you earlier. We've created this free of cost website
Yeah.
that is discover by drdangs.com. Anyone can literally log on to it from their mobile phones or their websites, take a quick 3-minute quiz, and you get a personalized curated profile so that the girl who actually suspected of having PCOS does the hormonal tests, and the overweight lady who's starting to work out, wants to check her risk for diabetes and cardiac risk, does the correct tests.
Correct.
And both of them don't end up doing irrelevant tests and wasting their time and money.
Correct. Correct.
So, we come across these nutrigenomic tests where they not only tell you what all you should be eating, but also classify you as an individual and what kind of exercise would benefit you most. Is it more of endurance training, strength training? Is it more of speed? Is it more of cardio? I mean, could you tell us a little bit more about that and what kind of exercise regimen do you make for persons unique to them?
So, interesting that you asked me this. When we are looking at somebody's longevity and health span, we want them to be well rounded athletes. It's not that if somebody has great cardiovascular health, that person doesn't have a propensity to sarcopenia or cachexia, where they lose muscle and then maybe because of frailty or lack of stability, they fall, which is one of the leading causes of accident related deaths in the world. They fall prey to that. Or if somebody is really, really strong and has a lot of muscle and is maybe over muscled, and because of that, he's very big or heavy, he has huge strain on his cardiovascular health. So whenever we're creating a plan for someone, we try and test them on certain things. Some of those things would be a resting heart rate, a VO2 max test, to see how well how their body is able to consume oxygen and efficiently sort of utilize it. Some of the other things that we test is grip strength, right? And some other mobility related tests as well, which allow you to know how their joints are when it comes to, movement and performance and performing daily activities. So when we are crafting a program for someone, it's not only, uh, of course, this is very, very important, the blood tests that we do, but at the same time, there are certain physical tests to assess someone's overall well-being and health and how they could probably have the freedom of independence when they grow older. Because when you're, let's say abroad, and when you're traveling and when you have to go from maybe a station to another or a terminal to another, you have to carry your own luggage and maybe sprint
Course.
past things and maybe put things on top and of all of that. So we always try to create the most well-rounded uh, athlete who has strength, endurance, power also. Power happens to be one of those things which exponentially goes down by age. So it's a very good indicator of how you're aging biologically. We do that test as well. And when we craft a program for someone, we're actually looking at bringing an individual to a very, very, let's say, all-rounded attributes when it comes to strength, cardiovascular health, joint health, mobility, strength, etc., all of that. So that's how we navigate our training programs and all of that. I hope that answers your
Yeah.
question.
So I have one more question,
Yeah,
and
please.
very pertinent to the world that we live in today. And I get these youngsters, and with the kind of stress these days in the corporate world, and all of these lifestyle things mixed with it, these are young boys who are complaining of a low testosterone level.
Yeah.
And I mean, there are a million YouTube videos also available on this, and what to eat and what not to eat and which exercise to do.
Right.
But I thought that I'll take this opportunity also to discuss this with our viewers today. And if you have to probably describe on your fingertips, what are the 2, 3, 4, or 5 main things
Right.
that youngsters these days should follow to protect a very, very important hormone in that body,
Right.
in their body, what would those be?
So when we talk about testosterone, it's actually a great indicator of your overall health as well. So you must definitely be doing something bad in order to affect it that way. I think it depends on the kind of food you eat. Um, let's say if your diet is rich in omega-3 fatty acids, you should have the, let's say, ingredients in crude terms to produce that testosterone. If you train strength, you also send a signal, which is chemical, which is through your adrenal glands, the catecholamines, which increase epinephrine. In that response, you have testosterone. And chronically also, because you have increased demands, and neurologically as well, which is through your HPTA, you send a signal to your body to produce more testosterone, thereby have more protein synthesis, more strength, etc. And I think one very important thing that people miss out on is sleep. If you're not getting those 7 to 8 hours of sleep, there's no way you're going to have good amounts of testosterone. In fact, chronically sleep deprived people, no matter how strong they are, even if they're in the army or the SEALs or whatever it is, and they've trained like that, if you check them after that, bout of sleep deprivation, they're probably the lowest when it comes to testosterone. So I think stress, nutrition, and training can definitely change your game when it comes to fixing your testosterone-related problems.
I think completely agree with you there. And also adding, I think stress and smoking also
Yeah,
to
yeah.
reduce levels of both. I think that would also be something that should go as an advice for the youngsters.
Yeah.
I was also reading that testosterone now is related to cardiac health. There are studies that say that people with a lower testosterone level have a higher risk of
Because it
cardiac
protects your
events.
endothelial cells.
Exactly. So now they're also referring to something that we call as andropause,
Yeah.
similar to menopause when your testosterone declines. And great to see you are doing such good work with people around that age to help them live longer and healthier.
Yeah. Yeah. Thank you so much. So, doctor, another question. This disease has come up, and I've seen a lot more cases of it. I'm sure you have as well. And unfortunately, it spooks a lot of people out, and rightfully so, which would be cancer, right? And we at Odds Fitness don't claim to, fix cancer as a disease or anything, but I think we can significantly reduce um, the probability of somebody getting certain types of cancers, let's say breast cancer or other obesity related, because obesity on its own puts somebody at cancer, at high cancer risk. Also, when we're training someone, we're not only just training them physically, we're also mentally coaching them. So definitely smoking and alcohol play a huge role. And, when we recommend nutrition also, we also tell them how to avoid certain foods that might lead to cancer. So when it comes to testing, what is it that somebody can do to just as a screening method know, okay, if they're healthy or not? And since it's come up in even in younger populations, not so old, 50, 40 as well, what can one do to prevent, not prevent, but let's say at least know that this is something that's happening in their body? Because I think one of the biggest way to sort of cure, the only way, is to know it as early as possible, right? So I think diagnostic methods in that process are absolutely, absolutely crucial.
So I wish I had a very clear answer for that.
Yeah.
But unfortunately, I'm not going to speak about the whole genome sequences and those high-end tests that everyone doesn't have access to.
Yeah.
I'm going to talk about easily implementable ways of diagnosing cancer at the right time. And I think the one key takeaway that I'd want today's viewers to have is that, and the most important, is that your regular checkups and seeing your doctor when you have an issue. Now, for example, if you pass if you pass blood in your stool,
Yeah.
I mean, 8 out of 10 times, or maybe 9 out of 10 times, it's either an infection or it is something like a hemorrhoid or it's just a little capillary that's burst. I mean, but that's the time that you see your doctor.
Right.
I mean, suppose you're dieting and you're exercising, but then suddenly you see your weighing scale and you've lost maybe 3, 4, 5 kgs in a month. I know you'd want to be happy, but excessive unexplained weight loss
Yeah.
is when you should see your doctor.
Right.
Okay, you've had a fever. Usually fevers, if it's an infection or if it's a flu, last for 5 to 7 days. If you're in the elderly population, maybe 7 to 10 days. With children, sometimes couple of weeks. But any unexplained fever for a duration of more than 2 to 3 weeks, you have to see your doctor. So, I mean, these are very basic things, but you should learn how to identify these red flags and when to see your doctor. I mean, if you have a cold and a cough and you want to rest it out at home and have home therapies and some soup and warm tea and recover, I'm fine with that. But none of these red flags. Suppose you feel a lump or a bump somewhere in your body, you have to see your doctor. So, I'm not going to over stress upon the utility of testing.
Right.
Because again, I feel the lab and my lab reports only support the doctor in making a timely and correct medical decision,
Right.
because of which they can again give the treatment accordingly. Now, there are certain tests, and also very proud to say that science has evolved over the past few years, where there are certain tests that males and females should get done regularly as a screening test.
Yeah.
Now, these screening tests for males, especially more than the age of 45, is something that we call as PSA. PSA stands for prostate specific antigen. No matter how you're feeling, no matter if you have any symptoms or not, I would urge everyone to get yourselves and your fathers, grandfathers tested for a simple total PSA test. If you can get a PSA profile done, it has a total PSA, a free PSA, and a ratio. This is one of the best screening tests for prostate cancer. And the lovely part about prostate cancer also is that, like you said, if identified in time,
Yeah.
I know people who probably die with the disease, but not because of it.
Yeah.
So I think the entire aim is to actually revolutionize patient impact in a way that the disease is not affecting their life at all. Again, for women, it would be cervical cancer. Today, cervical cancer, again, not only vaccinations for HPV that are widely available, but also pap smears that are recommended for anyone over the age of 21. And these should be done every 3 to 5 years, depending on your status. Also, mammograms, again, are extremely important for breast cancer. And there is a particular protocol that your gynecologist will tell you. But I mean, apart from these, your regular metabolic panel checks, like your complete blood counts and your basic parameters, I mean, is what will actually help you. Like this say, stitch in time saves nine. I think it is very basics. Everyone cannot get a genomic test done. I'm fine with that.
What about
But
what about tumor markers that you
yeah,
find?
so these PSA tests like the PSA are also tumor markers. These days, you have extremely sensitive tumor markers such as CA 19.9 for your colon, CEA for your gut, CA 15.3 for your breast, CA 72.4 for your stomach. But you can get these tests done because they have a significantly high negative predictive value. What I mean by that is that if these tests are negative, you would know that there is no malignancy in your body that's at a higher level, and you can rule them out. But for example, if a girl gets a CA 125 done, and CA 125, when you Google it, it's going to lead you to the worst, like ovarian cancer and things like that. But if someone has PCOS and has inflammation, your CA 125 is going to come high.
Right.
And it's going to cause you a lot of anxiety and a lot of stress.
Right.
So, with these tumor markers, it's very important that you have your doctor interpret them. And please don't use Google to interpret these tests.
So would it be safe to say that some of these tests will have a very high sensitivity and low specificity?
Yes, it would be, but then again, there are false positives in cases of inflammation.
Right.
For example, like I said, a PCOS person, lady can have an elevated CA 125, but it doesn't mean that she has cancer.
Right.
It just means that there is some kind of inflammation, and once that subsides, they should
Right.
repeat the test and hopefully it should be normal.
Right. Of course. Another disease which I refer to as a novelty disease in India, because very few of us make it to that level, would be neurodegenerative diseases like Parkinson's, Alzheimer's, dementia. Um, are there any kinds of tests that can probably tell who's at a risk?
Yes. So currently we offer the ApoE4 test.
Yeah.
The ApoE4 test basically again stratifies you into a particular genotype, and that tells you the risk for you of developing Alzheimer's. Also, there are certain other tests that we plan to launch in the coming year. These are basic tau proteins that again tell you about your risk of having or developing Alzheimer's. Now, you would know better than me, but there are a lot of lifestyle interventions that one can do once you identify that particular genotype that's at a higher risk. Like there is the Mediterranean diet and exercise and other lifestyle changes that
Sleep.
you can make. Yes.
Because when you sleep, your cerebrospinal fluid sort of works hard to get rid of tau and amyloid beta,
Yeah.
which you find in these.
So you optimize the four pillars that we've been talking about: diet, exercise, sleep, and stress,
Right.
and try and make your lifestyle more robust so that your chances of developing that disease are lesser.
Right. Of course. Last but not the least, something that brings together a lot of these diseases, which would be cardiovascular, um, cancer, and also metabolic diseases. What do you think are the key inflammatory markers that one should get tested for certain? And what could they be indicative of? And let's say if, okay, let's just go with this question first and then I ask him my next question. Yeah.
Of course. So, I feel that when you talk about inflammation and measuring and monitoring it, it's first very important, like I explained earlier today, is not to test when you have some kind of an ailment. If you're nursing that small injury that you have, or that sprained ankle, or that sprained back, wait for those to subside, because the inflammatory markers are going to come high because of that injury, and that's not going to be accurate for your own good. So, when you're feeling absolutely fine, the one test that I would tell you is the high sensitivity CRP.
Yeah.
It will not only tell you about your baseline inflammation, but also about your cardiac health.
Yes.
Apart from this, another inflammatory marker that I would suggest, a lot of people are going to suggest ESR, but in my practice, I've seen that there's a lot of fluctuation in ESR. So I'd rather prefer something like a ferritin.
Right.
Now, people are going to listen to that and say, what is ferritin? Isn't it a form of iron? So basically, to break it up for you, ferritin in as a lab marker is used as two types. The first type of ferritin, or the first way of interpreting ferritin, is as the stored form of iron.
Right.
The second way of interpreting ferritin is as an acute phase reactant that increases whenever there is some kind of inflammation in your body.
Yeah.
So I think these two are extremely critical. People also might tell you ESR to monitor. They might also tell you fibrinogen, D-dimer, and other things. But I feel high sensitivity CRP and then the ferritin is going to give you a good idea about your overall inflammation, and also simple to monitor moving ahead.
What about TNF alpha and all these interleukin
So,
6?
so TNF alpha, interleukin 6, these are more for people who have a particular disease, they are on medication, and they want to track the levels of the same.
Right.
Not for someone who's completely fit and completely healthy and then they want to do it. If they can do it and they have the resources to do it, then well and good. But otherwise, it is for conditions where people are on treatment. Another very important test that people can probably do is called leptin and adiponectin.
Yeah.
So, leptin is again your hunger hormone, and people with an elevated leptin can have dietary interventions to reduce that leptin level. There are a lot of people who come to us for these particular tests, and it's a very simple test to do with a blood test.
Right, right, right. We see a lot of people who are not sleeping appropriately, elevated levels of leptin and cortisol, of course. What do you think about cortisol?
Okay, so again, cortisol, stress hormone. But now what science tells us is that serum cortisol is not a great indicator of the cortisol levels. What you need is a CAR, that's a cortisol awakening response. It's a test that we offer where we test your cortisol through saliva, and this is done at multiple times in the day. That gives you a very good trend and also helps us mitigate the diurnal variation that you'll see with a marker like cortisol.
Right, right. Because it's important for waking up. It's not all that bad. It is an important hormone. Yeah. Okay, so that's it for today. I think we had a great conversation. I think we've gone through most of the things that we spoke about. I have still a lot of questions left. I'll get back to you with them soon. Thanks for watching us, and I hope you guys learn something from our podcast series. And with our pool of experts, such as Doctor here himself, we try and bring you the best solutions for your health and your fitness at Odds Fitness. Thank you so much.